Bismillahirrahmanirrahim. Now we are going to look at the brachial plexus. Very important topic. So actually we are going to study the nerve supply of your upper limb, because the brachial plexus is going to supply the mainly the your upper limb. So idea is that what does mean by plexus? So they are actually network of nerves. This is property of spinal nerve. So the ventral of spinal nerve, because when you study the spinal nerves, they came out in two division. Ventral mean in front or interior, and the dorsal mean backward or to the back. So dorsal goes back and supply the back of your body, and the ventral go in front and supply they may be involved in the plexus. So just remember, the plexus is the property of the spinal nerves, and the ventral rami mean some branch, and the ventral mean interior or in front. So you just need, because I have uh, discussed the definition of plexus. A lot of students, they may have passed their exam, but they don't know what does mean the plexus. Simply network. Now what, this is basic concept you should know. So plex is what it is, the ventral rami of spinal nerves. So they form the network when spinal nerve, ventral rami of spinal nerve, they form the network. So that network is actually your brachial plexus. So actually your four plexus in your vertebral level. So two are right here, the brachial as the cervical, and two are at the lower extremity or at the lower end, mean lumbar and sacral. Thoracic are not involved in the any the plex formation. They are simply nerves. You know better the intercostal nerve. So thoracic nerve, they are not involved in the. But just remember, the main point is the ventral rami. So we are start with the some basic idea, then we add more and more mnemonic and tricky way to understand the brachial plexus. So as I mentioned, these are ventral rami have spinal nerve. So which nerves are involved? First question is that which nerves are involved in the brachial plexus? So 5, C5, C6, C7, C8, and T1. So these are 5 nerves. So actually you have 7 cervical vertebra but 8 nerves. Just remember, this is also a confusion point. 7, and this number of vertebra at the cervical are 7, but the nerves are 8. So now look at these are, we call them the root. So these are roots, and these roots, the upper two and the lower two, we have to form 3 trunks. So they are formed like this. The 5 and 6, they add in a friendly manner, they form a trunk, and the 8 and T1, they form another trunk, and 7 is simply they are not they are single. This single root come and form the middle layer. So we call them, this is the your the superior, this is middle trunk, and this is the inferior trunk. So these are trunks, and these trunk, each trunk divide into two, like the interior division and posterior division. So interior division, posterior division, interior division, posterior. Interior means something in front, and the posterior means something on the back. So interior division, posterior. So these are the divisions of your trunk, interior, posterior. So this is called division. I think this is clear. So now look at the cord formation, how they are formed. So actually these posterior of all the division, so these, they form a posterior cord. So this cord name is the posterior cord. Make a sense? And these the interior division of your the superior and middle trunk, they form the other. This is another trunk. So this trunk is the lateral trunk. Make sense? So and the last one, the single interior remaining one is forming the another trunk. So sorry, other cord. So this cord is the medial cord. Why we are calling them the lateral posterior, medial or posterior? Because they are. This is actually the relation with the axillary artery, which is posterior is on the backward, on the posterior aspect of axillary artery, and lateral is on the lateral aspect of your the axillary artery. Medial is at the medial aspect of your axillary artery. So these are called cords. Make a sense? So these cords, they are actually divide and form the 5 nerves. So one nerve coming from right from here. So this is your musculocutaneous. Musculocutaneous. Don't worry, I explain in a tricky way, so there is no need to worry. And from the posterior, your axillary and the radial nerve came out, and from the medial, the ulnar mainly comes. And the one remaining one, which is formed by the union of the lateral and medial cord, is the median nerve. Make a sense? So this is some rough idea for conceptual point. So these are called branches. So story is very simple. I explain in a tricky way. So there is no need to write. I read write. So then you uncap your pen and write. So first we have set a root, trunk, division, chords, branches. So 5, 5, 3. You can easily 5, 3, 6, 3, 5. So center is 6, 5, 3, 3, 5. Same way pattern. So 5 branches, 3 chords, 3 trunk, 6 division, 5 root. So this is some rough idea. Now I draw a tricky way and more stuff. I think everyone has know the basic idea. Now try to draw it, because as many times you draw it, you will gain more and more stuff. So simply for a tricky way drawing, so draw 3y. One like this, and the other like this, and this is the right way, and this is an opposite way. So you draw. I think you can draw it easily. No, add more stuff here. So simply put 2w, one right here. I think everybody is easily, and 1w right here. Make a sense? And draw a line right here and make it like X. Thank you very much. So let's put in stuff. So these are your C5, C6, C7, C8, and T1. Make a sense? And these are your 3 trunks. So these are roots, and these are trunks, and these are your the divisions, and these are your 3 chords, 1, 2, 3. So these are chords, and these are right here are branches. So if you are confused the series of the row trunk division, so simply I put a the trick right here. Trick is that simply root and as you know better A B C D. So go in opposite way from D C B, D C B, D C B. R represent roots, T represent trunk. So this is the pattern actually. D represent division and C represent what? Chords, and B represent branches. Make a sense? So very easy way. So root, trunk, division, chords, branches. So now name them. This is your superior trunk, middle trunk, and inferior trunk. And if I recolor it to make it easy, because this is posterior cord, so I change the color for the posterior cord like this. Simply I'm not changing the structure, I'm simply changing the color. So thank so this is becoming your posterior cord. So just remember, this is posterior your axillary artery. Make a sense? So this is your posterior cord, and this is your the lateral cord, because it related to the axillary artery, and this is your medial cord. So you can see here, this is the if this is the interior division, and this is the posterior division, which is involving in the posterior cord formation, and this is the also interior division. This is the posterior division, this is the posterior division, and this is the interior division. Make a sense? Very easy way. So 5 nerve. Simple trick is that MAM rule. Simply MAM rule. Just remember this, so you can easily add stuff for the branch. So MAM first time right here, and this is your musculocutaneous. Make a sense? And A represent what? Axillary nerve right here. M represent what? Median nerve. Make a sense? R represent what? Radial nerve. And U represent what? Ulnar nerve. I think everyone can understand that. And the important question is the root value of each nerve. What is the root value of? So simply use this trick, MAM rule. MAM rule is what? Actually, MAM rule says, it's not a conceptual point of your anatomy, it is simply a trick or mnemonic. So MAM rule is that the 3 2 4 5 2 3 2 4 5 2 3 2 4 5 2. Repeat with me. 3 2 4 5 2 3 2 4 5 2. So now before I mention right here, so how can we utilize this trick right here? Wait a second. So 3 2, if I simply put right here, then because we have 5 roots, so 5 roots right here. So don't try if you have not a removable marker. So if this is 5, this is 6, and this is 7, and this is the 8, and this is the T1. Make a sense? 5, 6, 7, 8, and T1. Now put this rule right here. So I am putting, and in order to understand the, put the simply values of musculocutaneous, axillary, radial, and median, and ulnar nerve. So 3 like this. So what is the root value? 5, 6, 7. 5, 6, 7. C5, 6, 7 is the root value of your musculocutaneous. 3, 2, 4, 5, 2. Repeat with me. 3, 2, 4, 5, 2. Last two, ulnar, because this is ulnar. Make a sense? So if you practice 2 or 3 times, inshallah you will got it. This is the root value of your musculocutaneous. Now second is A, auxiliary. So auxiliary because 3, 2, these two. So 3, 2 means this is the 5 and 6. So the root value for the auxiliary is the 5, C5 and C6. Median nerve 3, 2, 4, 6, 7, 8, T1. So C6, C7, C8 and T1. Make sense? Now 3 covered, 2 covered, 4 covered and 5 for the radial. So 5 all 5s are involved, mean C6, C5 started from the C5, C5, 6, 7, 8 and T1. And for ulnar, last two, ulnar 8, C8 and T1. Make a sense? So these are the your root value of your each nerve. So I think you are easy with me. We have discussed the series and we have discussed the mem rule, very easy way. So just now I am adding more and more stuff. So starting from the nerves value. So actually there's some a lot of tricks are available at the different platform, but they are really confused when they add the nerve. So I'm simply very easy way I'm putting the nerves, adding top of the nerve. So starting from your right from here, from the roots, so nerves which are coming from the root. So from this is C5, so the nerves is coming is the dorsal scapular. So dorsal scapular. This is actually if you have studied the muscles of your upper limb. So the muscle of your this medial curve. So the medial side of your scapula, rhomboid major, rhomboid minor, and levator scapula. Rhomboid major, which are actually involved in the retraction, and the levator scapulae, which is involved in the elevation of scapula. So they are actually supplied by this dorsal scapular. So and right from here, so coming from right from here and now come move forward. So this is your actually sits the rotator cuff muscle, suprasupinatus and infrasupinatus. For suprasupinatus and infrasupinatus, for both we have the nerve that is suprascapular, which is moving in the notch which is present at the superior border of your the scapula. So suprascapular, and from here to here now move forward. This is your clavicle. So the subclavius muscle, because the right from here, so from under the clavicle, this is the so nerve is subclavius. So subclavius nerve. So subclavius, I think this is much more clear. Now move forward. The you will find the serratus interior. So serratus interior is supplied by long thoracic. So we have draw long thoracic. So coming right from here, C5, C6. So C5 is involved, C6 is involved, C7 is involved. So these three are actually forming this long thoracic nerve. So this is actually for the serratus interior, for punching muscle. So actually, so that if you this is injured, winging of scapula. So long thoracic nerve. I think this is clear. So add the root value, serratus interior. For the rhomboid major and minor and levator scapulae, dorsal scapular. Come forward, suprasupinatus and infrasupinatus, suprascapular. For subclavius, the subclavial muscle for the subclavius nerve, and for the serratus interior, the long thoracic nerve. I think you are still easy with this. Now come at the the lateral cord and the medial cord and cord level. So branching at the cord level is the one is the lateral pectoral, as the name represents it for the pectoral, and one is coming from here is the medial pectoral. So both are supplying the pectoral major muscle, and because lateral pectoral and the medial pectoral, because we have two parts of the pectoral major, because one is attached with the clavicle and other is attached with the sternum. So they are one supply the lateral one is supplied by lateral pectoral, other is supplied. So actually in common sense we can say the our pectoral major is supplied by two nerves coming from the core. So later, so I am simply talking the both, so they both are supplying your pectoral major. Make a sense? So now add, simply right here, upper, middle and lower. Upper, middle and lower, these are subscapular. So all these are subscapular. So upper, middle, so this middle come forward and form the thoracodorsal, and this is the lower sub. Upper is for the your actually subscapularis muscle, and lower is for the actually teres major muscle and the thoracodorsal, because we have studied the pectoris major, and remaining one is the subscapular, which is under the scapula. So under the surface, that is supplied by upper scapular, and the lower is supplied by the teres major, which is on the lower aspect of your the teres minor. So this is supplied by, and the thoracodorsal latissimus dorsi, the muscle of swimming. So that is supplied by latissimus thoracodorsal. So I think this is clear. Now add some more stuff. So right here, so the the branching level, so from the medial and other two nerves coming right here, that is the medial brachial cutaneous. So for the arm, so cutaneous nerve and the medial antebrachial cutaneous. Make a sense? So these are for the forearm. Antebrachial is used for the forearm and the brachial is used for the arm. So I think this is much more clear. So we have, if you put the very common question for the root value of the long thoracic is the C, you know better, C5, 6, 7. If you start from here, so this it has C5, root value C5, and for this you can say C5 and 6, and for here C5, C6. So you can write way. Posterior, just remember the posterior cord is always on the back of axillary artery. Now, as they are coming from the other question is the location of the root, trunk, division cords and branches. So because they are coming from the posterior triangle, or you can say the right from the root is coming from the here I use a trick, that is the peak and peak AB. Peak AB mean what? Peak represent your paravertebral, so the root are coming from the paravertebral, and A represent the interscalene, because the two muscle, interior and medial, so in between the two muscle, interscalene, and C mean what? It is under the posterior to the clavicle, or you can say subclavius. So under the posterior to the clavicle, and the are posterior to the clavicle, and the A represent what? A represent your axillary. So your axillary, and B represent brachii. So actually, so this is the location of your root, trunk, division cords and branches. So paravertebral, or you can say posterior neck of posterior triangle of your neck, and the trunk is intersacchaline. So sacchaline. So because two muscle, interior and the medial, in between the interior and medial sacchaline, the trunk are present, and the division are the posterior to the your clavicle, and the cords, they are very important. Relation with the cord is the axillary artery, and the branches are at the level of brachia, or you can say arm. So other name for the arm is the brachia, and anti-brachia for you use for the forearm. So actually cord relation is very important. So if you look at it like this, so if this is your posterior cord, and this is your medial cord, this is the lateral, because if this is the axillary artery, it posterior to it is the posterior cord, lateral to is the lateral cord, medial to is the medial cord. So actually they are present like this. So you will see on the posterior aspect of the axillary artery. So one or two other aspect. So what does mean by the prefix and postfix? As the name represent, prefix something at the present first. So on the, so if I tuck in the C4, you know better, C5, 6, 7, 8, T1 are involved in the brachial plexus. So if C4 become part of this brachial plexus, so such type of brachial plexus name is the prefixed. Make a sense? So another is the postfix. You can easily answer, mean if T2 is become part of this brachial plexus, so we name them the postfix. So these are very important aspects. And another important question regarding main question they ask is the branches of the posterior cord. You can simply answer upper, medial, lateral, or you can use the trick which I mostly use, is the stars or the ultra. So two mnemonics mostly are used, the ultra. So whatever you want to choose. So S represent your subscapular, T represent the thoracic dorsal, A represent the axillary, R represent the radial, S represent the other subscapular, that is the lower. So this is for the upper subscapular, this is for the lower. If you use this mnemonic, upper subscapular, lower subscapular, and T represent thoracodorsal, R represent the radial, A represent the axillary artery. So axillary nerve, sorry. So these are the mnemonic for that. And last but not the least, I'm not going to detail of the injury. I'm just naming the injury which are mostly involved with the brachial plexus. So if I injured at this level, injury at this level, what is this? This is your upper trunk or superior trunk. So upper trunk injury, which nerve will be affected, which will not? If you move like this, musculocutaneous is injured. Move like this, median is injured. And if you move like this, axillary and radial both will be injured. But ulnar is in the safe zone, because ulnar is going from the inferior trunk, not from the upper trunk. So if this is not going back, it is going from here. So ulnar is in the safe. If injury at this point, which nerve will be affected, which not affected? Ulnar will be affected. It is coming from here. Axillary and radial will be affected. Move like this, median is affected, but the musculocutaneous is in the safe zone, because you can see they are not coming into musculocutaneous. So don't confuse, because this is coming right here, not back. So musculocutaneous, if the upper trunk is injured, ulnar is the safe zone. If the lower trunk is injured, musculocutaneous is in the safe zone. So name of the upper trunk injury is the Ehrpelsi. So for the upper trunk, the name is the Ehrpelsi injury name, and the lower trunk injury name is what? The Klumpke's. So Klumpke's palsy. So these are two injuries, and very important, which is associated with the or we call them winged scapula or winging of scapula, that is associated with the long thoracic nerve. So when the punching muscle, which is serratus anterior, which is supplied by long thoracic nerve, when this muscle is injured, this nerve is injured at this point like this, so this we call them the winged scapula. So injury name is the winged scapula. Mean what? Your the medial border of your scapula will came out when you use this serratus anterior. So this came out. So you will see inshallah in the next detail of this injury. So 3 injury right here, and other injury may be associated with at the posterior. If this posterior cord is injured, so your axial and radial both will be affected. So we call them the wrist drop, and your deltoid is also paralyzed. So if the radial is injured, so we name them the also wrist drop, or the other name is wrist drop, or the other name is the Saturday night LC. So because mostly people at the weekend, which is Saturday night, they sit on the chair and like this. Most of time their posterior nerve, which is radial nerve, may be injured. So your extension, your wrist, which is the extensor muscle right here, so they may not be working. So the wrist drop condition will be appear. So this is the wrist drop. And if this nerve is injured, so auxiliary, because they are supplying only two muscles, deltoid and the teres. I use and the other name for the auxiliary, I call them the ATM cord. ATM cord mean what? The A represent auxiliary, TM represent the teres minor, and the D represent the deltoid. So injury associated with the auxiliary is also called the deltoid palsy. So auxiliary injury name is deltoid palsy. Deltoid paralysis. So deltoid paralysis or palsy, whatever you want to say. Make sense? So when this deltoid, what is the function of deltoid? Abduction. So before 15 is the supraspinatus, after 15 is the deltoid, and 15 to 90 is the deltoid, and 90 to upward is the trapezius and the levator scapula. So both muscles are involved in the abduction. So actually what will happen in the injury of musculocutaneous, because MMU, simply put, first I'm here, the flexor compartment of your arm, and the median is for the medial compartment, the flexor compartment of your forearm, and the ulnar is for your hand. So and only use a trick to, which is exceptional case for the that is the 1.5. So for the forearm 1.5 is supplied by, because they are exchanged by the ulnar and median. So 1.5 of your forearm, which is the flexor carpi ulnaris, that that is supplied by the ulnar, because all of our median except one, the flexor carpi ulnaris, and other half is what? The profundus. So the profundus digitorum profundus is actually has 4 tendons, only 2 of them are supplied by ulnar. So that is for the exception, 1.5 for the ulnar right here, and 1.5 at the hand is the median, which is supplied by the median. All of them are supplied by the ulnar except 1.5 muscle. One is the thenar and the half is the lumbrical. Actually your 4 lumbricals, 2 are supplied by your median nerve, lateral on the lateral aspect. So thinner, which are three muscles right here. So make a sense? So actually we will discuss the detail of this. So it is just a review. So you can utilize this single lecture for the revision of your whole module. So because if someone asks me where should I start, where should I end the upper limb, I simply answer brachial plexus. It is very important if you can utilize it for the revision of your whole module. So for example, muscle of the back, so there is no need to memorize the nerve supply of each muscle separately. You can memorize right from here. So trapezius, you know better, it is not supplied by brachial plexus, which is supplied by accessory nerve T11. So another, if you look at the rhomboid major, rhomboid minor, levator scapulae, they are supplied by dorsal scapular, and the latissimus dorsi is supplied by this thoracodorsal from the posterior cord, and the other muscle which are the your seats, which are the rotator cuff. So very important is the seats muscle. So you know better, seats, the supraspinatus, infraspinatus, teres minor, and the subscapular. So supra and infraspinatus are supplied by this suprascapular, and the teres minor you know better from the axillary, and the subscapular is supplied by this posterior cord branch subscapular. Make a sense? So these four muscle, and if you come on the anterior aspect, the pectoralis major is supplied by the lateral pectoral and the medial pectoral. If you look at the other one, that is teres minor, that is supplied by this lower subscapular. If you look at the serratus anterior, supplied by long thoracic nerve. Make a sense? So you can utilize this brachial plexus for the revision of your whole module. So if you add some other stuff, for example, action of the rhomboid minor and major, the retraction, levator scapulae, abduction, or abduction, and the elevation of scapula, and latissimus dorsi, which is muscle of swimming, and for the pectoralis major and minor, the rotation, mid rotation, and for the other sits muscle. So you can utilize this brachial plexus action with the nerve supply. You can revise whole module. And for the musculoskeletal, this is first time, this is second time, this is ulnar. Exception is 1.5 thinner, and the two lumbricals, carpi ulnaris and the digitorum profunda. So the half digitorum profunda, and the posterior side or the extender side is single nerve, that is the one and only radial nerve. So you can utilize this knowledge and for the revision of your whole module. I'm just sharing 2 or 3 pictures with you, so simply review them, because all the concept which I explained here is mentioned in the tabular form and the picture form. So inshallah we will meet with the next the injury of your brachial plexus. So thank you very much. Allah Hafiz.
These are our objectives. Course, innervated muscle actions, other major nerves, cutaneous degeneration, brachial nerve injury, upper brachial plexus lesion, and lower mid. So on this aspect, what you can see here, gray matter, white matter, and coming from here is dorsal root and ventral root. They are forming a union right here, dorsal rami and ventral rami. So this ventral rami is actually involved in the brachial plexus formation. So you can see here brachial plexus. So these are the ventral rami of C5, 6, 7, 8, and T1. So they are forming these trunks and the division posterior to the clavicle, and then cord formation right here in the axillary region, and the nerves, main 5 nerves are right here at the level of brachii or your arm. So you can see here also roots, trunks, and divisions, cords, and branches So these are actually picture which we have drawn. So you can see here the roots are there, trunks are right there, and division are right there, and these are chords and these are your branches. So you can see the other thing which is mentioned right here, that is Freinagle, which is 3, 4, 5, which are going to the your diaphragm. So Freinagle nerves, so they give one branch to right there, and the other thing which is mentioned right here is the first intercostal nerve, which is also coming from T1. So all other thing we have already discussed. So you can observe this picture right there. So if you are looking to details of we have already discussed, so you can go through it. And this is the actually table which will be very helpful to memorize the innervation of your throughout the upper limb branches and their innervation. And these are the, this is ARPLs you can see here. So injury at the upper trunk, so disabled arm, and this is the actually palsy condition, and this is the your plump case palsy, low trunk injury, and here is the saturated palsy, or you can say the wrist drop. Make a sense? So, and this is what, this is the nerve injury. Ape hand is actually median nerve injury, and the wrist drop is the radial nerve injury, and the claw hand is actually your ulnar nerve injury. Make sense? So these are actually picture, and this is very beautiful table. So spend good time with that, and you can understand a lot of concept of your upper limb. So these are the musculousness, origin, insertion, and their supplies, and the common cause of injury. We have to discuss the injury in the next part, and although we have go through it, radial median nerve and their the sensory motor innervation cause of injury, and the sensory motor this is a very beautiful table we will discuss in the next lecture. So thank you very much. uh, so this is all about your brachial plexus. Thank you.